Our topic today is health promotion. Early in the late 19th century, the early 20th centuries, there were things that public health had to change in order to increase the health of the individuals. Things like clean water and maintaining sewer systems, controlling infectious diseases such as influenza, coming up with vaccines such as the polio vaccine, making safer and healthier foods, eliminating the tin can in canned foods, the fluoridation of water to reduce the number of dental caries. And one of the most important in our lifetime is the recognition of tobacco as a health hazard. Since 1900, the lifespan in the United States has increased by 30 years. 25 of those years, according to the CDC, is due to the gains in health promotion. Early in the 1900s, colleges offered courses in health and hygiene. And then in the 1940s, there were calls for policies, programs, and services to improve individual and community health. At this point, the focus was shifting from dealing with individual illness to disease prevention. So preventing people from getting sick. Today's health promotion programs identify people who are engaging in risky health behavior and helping them to change them. So what is health promotion today? According to the Journal of Health Promotion, it is the art and science of helping people discover the synergies between their core passions and optimal health, enhancing their motivation to strive for optimal health, and supporting them in changing their lifestyle to move toward a state of optimal health. So what is optimal health? Optimal health is defined as a dynamic balance of physical, emotional, social, spiritual, and intellectual health. Lifestyle change can be facilitated through a combination of learning experiences that enhance access to environments that make positive health practices the easiest choice. So simply put, health promotion combines educational, organizational, procedural, social, financial, and environmental supports to reduce risk factors and promote healthy lifestyles. Health promotion today focuses on reducing and/or eliminating risky health behaviors. So what are some of the risky health behaviors that they're talking about? Things like smoking that promote lung and other cancers, heart disease, unhealthy diet, which contributes to diabetes and heart disease, a sedentary lifestyle, people who don't exercise, again contributing to diabetes and heart disease, substance abuse, liver disease, diabetes, heart disease, overdose risk, people who participate in unsafe sex practices, contribute to STDs, HIV, AIDS, and cancer. Gang involvements, which contributes to injury and death from violence, and no secondary education that gets people in low-paying or no-paying jobs. So let's look at some of the factors that affect health. They can actually be divided into two categories. Uncontrollable, those things such as hereditary, social circumstances, the availability of medical care, and in our environmental conditions aren't easily changed, and hereditary cannot be changed, as opposed to controllable behaviors, which are our lifestyle behaviors. So when we change our lifestyle behaviors, we want to move towards the optimal wellness. This is a health continuum, and all during our life, we want to move towards optimal wellness. We use the controllable factors to move towards the optimal wellness, and the way to move in that direction is to understand the dimensions of health and how these dimensions affect our overall wellness. So wherever you go, you may see different dimensions of health. I've seen 5, 6, 7, and 8, but we're going to focus on these 7. And the first one is the physical health, which is your body size and function. We all think about health. We think about nutrition and exercise. Those are parts of physical health. We also have social health, which is our interpersonal network and successful interaction with others. How do you relate to other people? What is your support network? Our intellectual health is the ability to think clearly and make responsible decisions. You do that by increasing your education. You are doing that by attending BCC. Your emotional health, which is your ability to express emotions in a positive way and maintain a level of self-confidence and self-efficacy. Environmental and planetary health is the appreciation of your external environment. Open lands that you have around us, you're being able to go on bike paths and walking paths and in different wooded areas. Spiritual health is having a sense of meaning and purpose in one's life. Spiritual health is not to be confused with religion. Religion is the practice. Spiritual health is having the sense of meaning and purpose in your life. And the last one that we're going to talk about is occupational health, and that's having a meaningful and stimulating job that you go to. So this is a chart of the dimensions of health and the way that it can be pictured. And in the center of these 7 dimensions of health, you'll find the wellness. So here you go with optimal wellness in the center of all of those dimensions of health. So we're going to look at health promotion in the Fall River area. And the way to understand the underlying reasons for these programs that have been developed through Healthy City Fall River is to look at the demographics of the area. The Massachusetts Department of Health collects data, and I've selected some of the data to show you so that you can better understand as we go through the course how these specific focus areas and programs were selected. So the social demographic indicators in the Southeast region, which includes the 3 large cities of Brockton, Fall River, and New Bedford, and also the Cape and the Islands. And so some of the important things to know is the per capita income. And you can see by looking at this chart how the income of Brockton, Fall River, and Bedford are greatly under the Massachusetts total. And this statistic was taken in 2000. So you're going to see these slides are taken from different years. Persons living below poverty, again, the number in these 3 cities, the percentage is much higher than Massachusetts. And then this here is the Southeast without the 3 largest cities. Children under 18 living below poverty, again, much higher than Massachusetts. Less high school education. And in this area, Fall River and Bedford really stand out. Those that are foreign born, speak another language other than English at home, and those that are unemployed, again, this number is greater than Massachusetts. The proportions of the different race and ethnicity in the largest cities, and this was taken in 2005. Majority in all 3 of these cities, white, non-Hispanic. However, Brockton has the lowest percentage, with the next highest percentage being black, non-Hispanic. The leading causes of death, and this was taken in 2005, Southeast region and Massachusetts follow the same patterns, the same sequence of heart disease, cancer, stroke, injuries, chronic low respiratory disease, influenza, pneumonia, Alzheimer, nephritis, which is a kidney disease, diabetes, and septicemia, which is blood infections. This is a chart that shows adults who are obese in the south coast of the islands. And it takes out, you see the Fall River, New Bedford, the 2 cities here. There's the Southeast region and the Cape and the Islands. In this chart, Brockton is not depicted. But you can see how Fall River and New Bedford are much higher than the islands and also for Massachusetts as a whole. Heart disease death by race and ethnicity from 2003 to 2005. In the Southeast region, the black non-Hispanic population is much higher than in Massachusetts as a whole. And you can see just by looking at these charts how heart disease and death is much higher in the Southeast region in general. Diabetes mortality rates, again, Brockton, Fall River, and New Bedford are much higher than the entire state of Massachusetts. Adults who currently smoke, and these are the areas of Massachusetts broken up. And you'll see southeast is 20.5, and this chart, central Massachusetts is higher. In all of Massachusetts, it's 18.1% of adults who currently smoke. Cancer rates by region, and these are numbers from 1999 to 2003. The pink depicts worse outcomes, significantly different from the state. So the Southeast stands out in prostate cancer, lung cancer, total cancers. Female breast cancer is also high. It's not as high. It's just a little bit higher than the state total, and colorectal cancer. HIV and AIDS in these different communities. You can see Brockton, Fall River, New Bedford depicted along with the South Coast area. And you can see how significant different these three cities are from the total Southeast and also from the Massachusetts totals. Infectious diseases, chlamydia and gonorrhea, those are STDs. Again, you see that Brockton, Fall River, and New Bedford stand out significantly higher than the Southeast and significantly higher than Massachusetts as a total. Asthma. And this chart is very telling, and this was in 2005, and look at the incidence of asthma in Fall River. Much, much higher than New Bedford and Brockton and Massachusetts as a whole. I'm wondering if you can come up with a reason that you would think that people in Fall River have such a high incidence of asthma. And if you really can't think of anything, I want you to go over the Braga Bridge and take a look into the town of Somerset and look at those two cooling towers that sit before the electric power plant. That is one of the dirtiest power plants in the Northeast. And the particulate matter that comes out spreads over a 30-mile area. So for summary, the residents of the larger communities like Brockton, Fall River, New Bedford, they have a poorer socioeconomic and health outcomes than the state does. So you're going to see that these disparities, those with poorer socioeconomic status, have a lesser degree of health. It can be based back to no education, no job, they don't have good housing, and therefore, and also cannot afford good health care. Brockton, Fall River, and New Bedford have poorer birth outcomes, higher teen birth rates. Fall River has higher obesity percentage. Heart disease and diabetes mortality rates are higher for Brockton, Fall River, New Bedford. Admission to substance abuse treatment rates are higher for Brockton, Fall River, New Bedford. Violence, firearm death rates, and HIV mortality are higher for Brockton and New Bedford. Asthma, ER rates, and high STD incidences in the Southeast in the top three cities, and we just saw that they're higher than those of the state. And smoking during pregnancy is higher in Fall River, New Bedford, and Taunton. I've provided a link in your folder so that you can go and see the entire report for the state of Massachusetts, and that's under the Massachusetts Department of Health link that will be in your folder this week.